So hello again, I am Yolanda, and we're going to start out by giving you your learning objectives. By the end of this session, you will be able to, or you should be able to explain the application of a community-based participatory research approach.
Okay, and you hear a lot about translational research, and how does translational research and community-based participatory research come together? And what I wanted to do was present the usual table that is used in showing the transition between T1, which is basic science research, to T2, which is practice-based research and dissemination, T3. So when you go from bench to bedside to practice, you see that you have case studies, and then the translation of the basic science research to the bedside, where we have controlled observational studies and clinical trials that are moved into the translation to human phase. And then we reach that T2 to T3 dissemination point, which is the practice-based research. So here we see phase 3 and phase 4 clinical trials, observational studies, and survey research. And these are oftentimes guided by the development, the guidelines and recommendations for treatment and diagnosis of illnesses, meta-analysis and systematic reviews that have been conducted, and also these then guide and inform the interventions that we, I'm sorry, that's somebody said, the interventions that we are designing for practice. So here we see where community-based participatory research is assisting in that translation from patients to practice, and practice specifically disseminating out into the community. So we will take you through how CBPR assists in that process. Dr. Samsel this morning identified how sometimes the problem is identified beforehand, and you walk through in identifying the evidence or the practice that you need to bring in and use those guidelines for the design of the intervention. So we will walk through that process and how CBPR helps in that.
Before we go through the steps, I want to introduce you to the Detroit Community Academic Urban Research Center. And what you see before you are a list of our partner organizations. The Detroit Community Academic Urban Research Center, which we call Detroit URC, is an overarching partnership that was established in 1995. From this core partnership, a number of URC affiliate project partnerships have been established. And today we will provide examples of how the URC, Detroit URC, and affiliate partnerships have engaged in CBPR.
If you look at the organizations and our partners, it's pretty diverse in community and also with a balance of academic partners as well. And we have partners in East Side Detroit, Southwest Detroit, as well as government partners like Yolanda representing both the community as well as the Detroit Health and Wellness Promotion Department.
Okay, I'm going to read you a statement that one of the Detroit URC's longstanding partners, Angie Reyes, has made concerning research. And her statement really exemplifies the attitude that some community people take on in terms of having research done in their community and not having it be a true partnership. I want to share the community's view of traditional research. If you can imagine a particular research project in which the researchers have identified the research question, how the data will be collected, who the participants will be, and so forth, which is pretty typical of projects that researchers have come to my organization on a regular basis with, wanting to conduct these projects in our community. And then, if you can imagine something like that occurring, and then a couple of months later, somebody else coming and saying, now we want to do projects on diabetes, and we want to survey everybody, and then we're going to go away. So then they do that particular project, and then another year later, somebody else comes back and says, we want to do a study on domestic violence. And then they do that spend several months collecting the data, and then they go away. And pretty soon, you just get tired. Get tired of people coming in and asking for a community, for our community to be involved in studies, because not only do they not want to give anything back to the community, they also take resources from the community. And because we're talking about community-based organizations, typically they have limited time and resources to begin with, and it's an investment for us to spend time contributing to somebody else's research that we don't benefit from. So it gets to be tiring after a while, and then you begin to mistrust that whole process. And pretty soon, you don't want to talk to anybody about research coming into your community or universities coming into your community and talking to you at all about conducting studies. Okay? So conducting CBPR really involves a paradigm shift on the part of the researchers. Typically, the thought that comes to many researchers is that these are groups of people with no resources. They're poor, they're going to be undereducated, they might not have any healthy behaviors, they're involved in substance abuse, whatever. So there's this thought process going on saying that I have to come in and help these people. I'm going to come in and save them. And they really neglect the fact that there are members in the community, leaders in the community, and residents in the community who are all skilled, educated, knowledgeable, and can teach researchers about what they're going to be doing in the community. For example, community members have a lot of knowledge about health behaviors and interventions in the community that researchers haven't been aware of. So it's a paradigm shift. It's thinking about the community in a whole different way as a partner rather than somebody that you're coming in and going and doing something to, but rather somebody you're going to be working alongside with.
I think that's, no. Yeah.
So it's a paradigm shift. What has happened because of the series of unpleasant experiences in my community is that I see my role as a gatekeeper, protecting my community from people who want to come in and do research that can potentially be harmful, or can even harm a relationship that I have with researchers doing community-based participatory research. Because if community members have a bad experience with one researcher, they're not going to want to let anybody else come in and do research either. At this point in time, when anybody comes to me wanting to do research from whatever university, I hand them the principles of CBPR, community-based participatory research, and I tell them, if you can follow these, then we can talk. But first, take them and read them, study them, and come back, and then we'll have a conversation. But most often, they don't come back. They'll find somebody else to go to, which is pretty typical.
So today, we're going to address some of the concerns expressed by Angie Reyes and other partners that we work with through the URC. Are there any thoughts or questions about her statement and how she has voiced the harm to the community, taking from the community, as well as, you know, the benefit of working with community and how researchers can learn in that mutual relationship in building that partnership? Yes, ma'am.
So do you think that perception is changing? CBPR has sort of become the way to go. Is it changing?
Absolutely. You have community members who are essentially community researchers. Now, they've become savvy enough to understand what true CBPR is and what equity is in research. And they know when someone is really trying to work with them or, you know, about them. I think there's still probably, obviously, a lot to be learned on either side, but yes, the paradigm is shifting.
Mm-hmm. Yes, please.
You mentioned a list, a formalized presentation of principles of community-based research. Do you have those? Is that something?
Yes.
Yes.
We're going to go through those in a little bit, the 8 principles, as well as the URC website has those available for downloading. And I don't know if Julia's here. Julia was going to come in, our Director of Communications, and she can also assist you. Carolyn?
One of the concerns I have is that the research sources don't get built into the budget of the grant up front to really acknowledge the contribution of the community, to really have, I think there's a lot in the community of people who want to give, and I really worry that we don't have it built in to be able to pay for those very valuable resources.
Well, I'll start out with kind of going back to the first question. Most of the people who the University of Michigan are dealing with through the Urban Research Center, they absolutely know what to expect, and University of Michigan Urban Research Center has been awesome in acknowledging the fact that there are resources that need to go into the community, so there's a stipend that's offered.
So we have stipends, partner stipends, that are included in our budgets up front. And those are range from a small pilot study, maybe $1,000, $1,500, to a larger study that would range from $3,000 to $5,000 per year. And that is over the course of the study period. We're going to talk about the structure itself and how our steering committee meetings and partners work together, and then we can come back and provide additional information about those stipends and how we budget them into our processes.
Okay.
So CBPR, BPR is an acknowledgement that there is a unique set of stressors and strengths within a community. So this is a viable approach for addressing both the strengths and the stressors, taking both into account. And as we know, it's important to do this in many ways for more equitable research as well as practices that are put into place. The acknowledgement of stressors include that there may be a lack of access to healthy and affordable food in the communities that we're working with. So if we're focused on diabetes or physical activity promotion, we need to be aware of the community. What are the local stressors? In Detroit, we have a stressor for, it is considered a food desert, and some of the URC-related studies have shown that there is a lack of affordable, healthy food, and an abundance, the density of fast food available is pretty high. The lack of access to safe places to be physically active. Again, if we're promoting physical activity, where will people come together to be active in a safe and place? Exposure to violence, poor air quality, and illegal dumping. These can be and translate into policy level practices within the city of Detroit or other settings. We are, through the URC, we primarily work in Detroit, so all of these examples Yolanda and I will come back into Detroit. The poor housing conditions may exist, including rental properties that are not kept up to date as far as inspections or lead. And then discrimination, historical discrimination, as well as, discrimination that may be new, related to unemployment, related to other issues in Detroit. Lack of access to affordable health care. This continues to be an issue, hopefully with health care reform in one package or another, that this will be addressed. We don't know where that is at the moment, though. And these conditions all contribute to the increasing disparities in health status between the rich and poor and white and non-white. In Detroit, we see these differences within communities, and not between necessarily, only between, but within communities of African American communities as well as Hispanic communities. But we also recognize the strengths of the communities that we work with, the knowledgeable and committed community members and leaders. There are so many leaders and partners that we work with that really help us and really clearly identify the issues and those stressors, understand the stressors, and understand the linkages between those stressors, which are very important for us as we build our conceptual frameworks for our research. Resources and services provided by community and faith-based organizations.